All right, there we go.
Yeah, we were talking about being out in the country, and our daughter is on a nature preserve out, in the middle of nowhere. And the kids are always outside, and they're the ones that hardly get sick. They're always digging around in the dirt and, looking at plants and animals. And, that's not necessarily a clean environment, but they stay pretty healthy.
So that's just say for everyone, even as older as just get outdoors. And we're even saying for nearsightedness is pandemic before COVID was pandemic, and to outdoors for an hour a day for everything, for eye health, body health, and everything. I'm not sure how often, especially with fibromyalgia, I mean, it's tough because of the pain and stuff like that.
I'm sure people I'm sure people got used to looking at computer screens and phones and stuff during the pandemic, so their vision probably really got affected, I would think.
And it's you don't want, it's indoor air.
Right.
Yeah, yes.
And
I can tell the difference in the wintertime. My eyes get so much drier because of the indoor air.
Indoor air.
Sometimes they burn and they sting. I feel like I have sand in them.
Yeah, and and it's sand feeling, that's the dryness, and saying, trying the drops, and people say how often I can put them in. And I tell people, if you have the non-preserved little vials or you can put in hourly if you want. Now there's some doctors that say, like, oh, that's way too much, dude. But I said it's not preserved. You got to get something that's a whole lot better than
my doctor tells me to use them as often as I need to. Yeah,
you need to, and that's what possibly the new nasal spray. But that's it, to stimulate your own glands, or to go to Xiidra or Restasis, which those two are two drops you put in your eye, and those are there to stimulate your own glands to do their job. So those three are around that category. Everything else we do is put something else in, try another medication to see if it helps.
Doctor, I have a question too. I know you mentioned back a while ago when people are more postmenopausal or whatever, women, their eyelids don't close all the way. I was reading a prevention and they mentioned something. Amazon has this product and it's through Dexterity Health. It's liquid MSM drops, and I think it's helping me more. And it's not from, China or anything weird. New York. It's US made, but it's not something you can buy over the counter. And I sent away for it, and it's called liquid MSM drop, and it's Dexterity Health. If you could find it, I found it kind of helped me in between the dry eye drops.
Yeah, fantastic. I've not heard of that. I'll look that up and see. That's great.
Yeah.
You said it's for postmenopausal women. Their eyes don't shut. Like is it the skin over their eyes?
They're more dry or something. I don't know. That's all the impression.
Yeah, one of the things is you're going to love this. We think it's testosterone. And you kind of look at me like, are you crazy? Isn't that the man hormone? Actually, women do make a little bit of testosterone.
Right.
Okay. Postmenopausal, it drops down like this. Guys make a bunch. Our postmenopausal drops down to this. We're still better than this. There was actually a study done, and they had 10 women in the study, of which 6 used to wear contacts, can no longer wear contacts because their eyes are so dry. They put them on a testosterone cream on their eyelids. 3 months later, 8 of the 10 were wearing contact lenses instead of the 6. But trying to get a testosterone cream approved for females, it's going to take a long time to get that to happen. And that's why the men just don't have as much of it. And what it's do is there's 2 types of oil glands in your lid. One for your tears to cover the water to prevent it from evaporating too quick. And the second oil gland is for your eyelashes, which is every single hair in your body has an oil gland for it. And the men have more problems with the eyelash one. So men will have a little more cakiness on their rim of on their lashes, whereas women experience the dryness because it evaporates just so quickly. And water's there, you got to have the water, but if you don't have the oil to protect it. So most of the drops that I was showing you all are some sort of form of oil. That's the omega-3, the refresh. They're all more oil based now. We're getting smarter.
Okay.
And listening to postmenopausal women that they have 80% of the eye drop of the dry eye problems.
Well, do these things, these pills and things like that affect our cholesterol when we go for our blood test? Should we stop taking them before we go for a blood test for, health? Is it going to show up that much?
With these, they shouldn't. I didn't see any information on that of problems with that at all when I was looking through the studies.
Okay.
So that's a great question. It's saying, but there shouldn't be any problem with that
Okay.
up until now. Yeah.
Good.
Yeah. Now, Cindy, what was the drop that was? You said you had a question on that. Do you have the name of that? I completely forgot what the drop was.
No, I don't, it wasn't a question about that. It was for something else. I think one of the other ladies had a question. Was it Dorothy or was it you, Cheryl? I can't remember now.
I don't remember.
Brain fog. I don't remember.
Brain fog. Yeah.
Well, that's a sign of intelligence.
Yeah.
Okay. All right.
It is.
That's good.
Because you have
Okay.
so much information up there,
Yeah.
right? Over all the years. It's just
Mhm.
like a computer. You can only put so much data into a computer, and the computer starts running slower,
Ah.
takes longer to go. Guess
Okay.
what? Because we're more mature than we used to be, we've got so much data up here that we have to go through all that data. We have so much more information to go through to get to the answer, whereas somebody younger, they're not as smart as us.
Huh. I
So
never thought about
the
it like
more-
that.
The more you forget, the more fog you have, the smarter you are. You're getting to be a
All right.
genius.
I'll take that.
Sounds reasonable to me.
I have a quick question about eye bags, like here and here.
Here. Yeah.
It's like, is there a certain doctor that you go to? I know that my mom had it. I know I'll probably get it, where the eyelids came down and it affected her vision, where it would come and almost cover part of
Yeah.
her eye,
That's
Right.
what's happening with my mom, actually, I think.
Is
So-
there a particular doctor that you go to?
Right. So most ophthalmologists can handle a little bit of surgery on that. And so in the eyelid, to hold the eyelid up, there's muscles and there's ligaments, and they're kind of combined together. So it depends on whether is the muscle weak, is the ligament weak. We also have a little thing all around your eye is fatty tissue to cushion it. That's the shock absorber. But that tissue become thin, and now the fatty tissue comes through and just pulls the eyelid down. So there's different reasons for that. Most ophthalmologists can do a little bit, but now we have a group, and they are that we refer to. They're consultants in facial and ophthalmic plastic surgery, and they are ophthalmologists that specialize in plastics of the face only. So they won't do tummy tucks or breast implants or liposuction or whatever. That's all they do is face and eyelids, and we refer to them a lot. The other thing that you can try is something called Upneek. Now, this is prescription only.
Yeah. And what does that do? You put it on your eye?
You put a drop in, you put a drop in your eye, and what it does is contracts the upper eyelid muscle. So when it contracts it, it pulls it up. And we have a number of people that say you put the drop in. I always like to do a test run here in the office when we're talking about it. And I'll just do it. I have them take a picture of their face, put a drop in one eye, and 20 minutes later, take another picture, and you can see what the difference is if it does. Now, for me, with the skin here, it doesn't affect that. It's the eyelid muscle. So if it's the skin coming down, it won't have any effect on it. If it's the muscle, it'll pull it up. And I've had two patients where they liked it went up so much, they went to the surgeons and got eyelid surgery. So they wouldn't have to use the drop all the time. But I have people that use the drop. They said, like, I'm around the house, whatever, I don't use it. But when I go out again, I'll put a drop of that in, and pulls my eyelids up, and it makes it, it's wider and clearer. And the people that say, I think I see better, saying, we might want to consider surgery, and saying, instead of using the drop all the time. So
I know it's hereditary in my family. My dad had it too, so I've got the good genes for it. So
yeah.
what
So
else?
So if you've had the surgery and you still have a droop, can you use the eye drop? My husband he got the droop after he had glaucoma surgery, and then they did the plastic surgery, probably the same group you're talking about. I think Dr. Black.
Yeah,
Um,
Dr. Black, yeah.
and they did a good job, but they said they raised it as far as they could, and it's still a slight droop. Would the drops help him at all?
That's a great question. I have a couple of patients that have had post-surgery like a year or two, and I said, try the drops now. Let's see if it makes any difference to
Okay.
go out. So that it could help to raise it up a little bit, because plastic surgery is only good for so long.
Mhm,
And they'll tell
mhm,
you it's only good for about, maybe 5 to 6 years, some people a little bit less. And
Mhm.
saying, so you can try the drop and see if it makes any difference at all.
mhm,
And say,
mhm.
It's
and
good
saying, so
that they
that's not
have
bad,
that.
but it's a prescription only drop
Okay, okay.
that we use a lot of. Okay. And that one through, you transitioned right into that last drop. That was really, really good. Now the other thing with the eyelids too is, and again, it's more so with the oil glands, is hot compresses.
Yes,
Saying, so
yes.
the oils, and what they are is they're not producing enough, or they're producing, the oils are too thick. And how do you get thick oil thin? You melt it. And so I tell people say, oh, I'll use a warm compress. I said, no, hot. Hot
Oh,
compress.
okay. I use warm. Okay.
Hot. I tell people, go ahead and heat up a bowl of water in the microwave, and when you touch it with your wrist and not burn yourself, that's what you want. Okay,
Oh,
that heat. And actually it should be, we tell people 106 to 108 degrees.
Mm.
And saying a lot of some tap water that doesn't even get that hot. And
mhm.
saying, so the tap water, and saying, and you want to put it on. The bad news is within 30 seconds, it gets cool again.
Cool.
So I
Yeah.
say, yeah, use that water, just heat it up again. Or some people say, well, I can heat up one of those little rice bags or what those things are. And if you can wrap it with a cloth, a damp cloth that's hot, and hold that on there, is good. You don't want to squeeze your eye to do it, because those glands are right at the base of the lash. Okay. And they're right there. So if you close your eyes and do this, not going to work, because it's not getting there. If you put it up here, if you put it down here, not going to work. You've got to be right on the lash line. Okay.
Oh,
It's got to be
okay.
right there. And after I tell 2 to 3, 4 minutes, you've been doing that, then you want to massage it. Okay.
Mm.
And if you rub it right now and you feel it right now, it's going to be a little irritating. But after
Mhm.
you put that warm, moist heat on it, it's not as bad. And again, you want to rub that lash line. Keep the eye closed so you're not rubbing your eye, but do not squeeze. And I tell people, you can't be dainty, but do not poke your eye out through your ear. Okay. So you can massage that. I say, you take showers, you take a hot shower, that counts. That's great. Let that warm water run. You get out and just use that towel and just on that lid. And what's interesting, it's the middle bottom third that's actually the most important. And saying, so when people come in and I test their tears, we'll check to see how long their tears are staying in. And then what I do is I say, okay, it's low. And then I will massage and rub that bottom third and then retest the tear. And if that goes up, all of a sudden their tears are lasting longer. We know, hey, it's oil. It's oil. And you got to heat it up. There's a couple of different things now. There's something called IPL, if anyone's heard of that. Dermatologists use it for rosacea and acne, but it's a intense pulse light therapy. But they found out that, guess what? It works great on the eyelids too. And a lot of these people having treatment, this light pulse for treatment for acne, found out that their dry eye went away, and it helped out with the oil glands.
Okay.
And saying, so now some doctors can just do the eyelids alone. But the problem is the insurance doesn't pay for it. And it's like $500 to $700 for a treatment. And you got to have treatments every few months. I'm going, that doesn't make sense. I said, if you can do a hot compress and get that to get it flowing would be really good. And again, omega-3s are good for that too, for the oils, to do that. And that's what we're saying with the oils there. So it's the intense light pulse. There's another one where it's a device that it clips over your eyelid. It's kind of like having your eyelid here and a clip that goes over. On the front of it is a pressure sensor, and on the back is a heater. And it heats your eye up to 108 degrees, that lit up. And when it reaches that, the front part squeezes it and keeps squeezing. So it goes down on the upper lid, goes down, and on the bottom it goes up to squeeze out all that oil. And supposedly that can last 6 months to a year. But that's like $700 or $1,000 of treatment. And insurance doesn't pay for it.
Wow.
saying, but I said, so let's do the simple stuff and saying, you know, the artificial tears, if not, we've got the Zydra, we've got the Restasis, we now have the nasal drops, nasal spray to see, and now we got some new eye drops too, to see if that can help out at all. Okay. Any other questions on that or other questions?
On the nasal spray,
Correct.
so I use nasal sprays for sinus allergies and that kind of thing. Would that interfere with the sinus nasal spray or?
Great question. It's not supposed to. That's what we
Okay.
were told. Okay.
Okay.
I don't know. We've been using it for about a year now. We're getting more and more people going to it, and some people just, you know, put a spray in my nose for my eyes and go, yeah, it's how it works. It's a
Okay.
little, but we have with some people that just do not like to put drops in, or very difficult to put drops in, but you can use a nasal spray easier. So it's a little squeeze in the nose.
Yeah, my dad, when he was alive, I used to have to put drops in for him. He couldn't do it. He got all flustered. And he, you know, I have no problem. I could even do it in the dark, you know. I'm so used to it. But he just, you know, some people really have a difficulty, and he was, yeah.
Yeah. No,
I'm sure
and
you
here's the-
know.
Yeah. Now, here's the thing with people that don't like drops and saying, if you got to put drops in, say, great. I have them just put their head back, close their eyes gently. Now, when your head back, you put the drop in the inside corner here by the nose. And since your head's back, it's not running down. And then your bottom lid is pretty weak compared to the top lid. Then you just kind of pull the bottom lid down a little bit and it falls in. And you get both eyes
I
at the
wish-
same time.
I wish I would have
And-
known.
Yeah, it's both eyes at the same time, and it's great. When I have little kids, we got to put drops in little kids' eyes, and they're going crazy. Of course, we're not going to get drops in your eyes.
Mhm.
So I do that. I said, you don't even have to have your eyes open with drops in, and they kind of like, oh, this guy's kind of crazy. Who is he? And so we'll do that, and I talk crazy voices while we're doing it, and they just laugh about it. And it's also, it doesn't sting as much when you do that,
Okay.
because one of the reasons for sting is temperature gradient. Body temperature, air temperature. So when you put that drop on the skin right here and your head's back, it's starting to heat up already because of your body temperature. Plus you have natural oils that are there. And I've had doctors tell me that, well, that's unsanitary. You know, I go, it's your own oils. You know, it's natural oils and it's going there anyways. And it mixes, and that'll calm it down a little bit too. And so anybody having problems or doing, put the head back, drop in the corner, pull the bottom lid down. It's interesting. The upper eyelid has the second strongest muscle per unit area of any muscle in the body.
Huh.
Okay.
Wow.
The lower lid, one of the weakest.
Wow.
Wow.
Because you know, you try, like I say, you squeeze your eyes, you can't get that upper lid open. But for the bottom lid, you can pull that down a little bit easier, unless they're using their cheek muscles and trying to do that.
Can I ask a question about when a doctor dilates your eyes?
Sure.
Why do some people, like me, take hours, I mean, almost like a whole day to get the dilation out of my eyes?
Yes.
It's like, why do some people react so
Yep.
differently? I mean, my
Yep.
husband they put them in, and, you know, a couple hours, it's back to normal. Is it?
Number one is what drops they're using. Depends on what drops they're using. There's about 3 or 4 different drops that we use. Some will blow it open, and we want to keep it open as big as we possibly can for as long as we can to get the look. Others, when I dilate, I don't, and it affects your close vision too. It makes things fuzzy if you haven't had cataract surgery. We use a drop, it gets it open pretty quick, but it also comes down really quick. So when we do it, we say, we don't want you to stay here too long. We're going to get it up, and I'm going to give you 20 minutes, and I'm going to come back in, and we can see big open pupils. And they say, yeah, it wasn't too bad. It also depends on your own genetics, and saying, you know, some people, you know, you can put a drop in somebody and it's just going to take forever. And I mean, everyone with fibromyalgia, you know that, and everybody reacts a little differently, and saying, you know, using this med or that med or whatever, exactly the same with drops. You react differently. And and they'll say that normally the darker the iris color, the tougher it is to open up, because there's a lot of pigment there. So we got to get that. The drop has to get to the muscle, and the color is the pigment, and the pigment will soak up the drop. Well, it doesn't get to the muscle then, so it doesn't work. So we have to put more in. Whereas lighter color eyes have less pigment, and so there's more to get to the muscle, and they'll blow up a lot quicker. The really interesting thing about that, there's only one color pigment for all eyes. You got a lot of it, it's brown. You got a little bit, it's blue. And that's just bizarre. I still don't understand it. I learned that my first year of optometry school, and still to this, it's you one color pigment and that's it. And then also it depends a little bit on blood flow. I don't know if you've ever seen people, especially with lighter color eyes, you know, when they're feeling really good, you look at their eyes and they're Paul Newman eyes. If they're not feeling good, they look a little grayer or whatever. And saying you can tell that's a blood flow through that iris too. Okay. Other questions?
Yeah, I wanted to mention I had a virtual reality visual field test the other day. He had these
you like
got, you know, before I used to have to put my chin in this thing with a clicker and this big screen, and it bothered me. It was like I almost dreaded it. But this time I had the virtual goggles on with and it was almost comfortable. It was almost fun, you know, to look at the
we've been toying-
spots.
Yeah, that's good. We've been toying with going into that, but we haven't, you know, just still waiting for it because we have 2 other visual field machines, and you know,
Yeah,
how much money do you want to spend?
yeah.
But they're actually coming out with now the virtual reality ones for visual fields that you can take home.
Wow.
And they're going to be so something you can do it at home, and saying so that you get these, you buy them, and they're going to be, you know, a few $100, and the person's going to be able to do it at home, and they send it in. The results go to the doctor's office.
Wow.
So instead of getting you know, for some people you need a field every 3 months, 4 months, or 6 months, and this way they say all we need is the field. We don't need to see you. So now you can do the field at home and just send us the information, and it saves you a trip.
Okay, they're looking for peripheral vision for
Right, for
visual
glaucoma.
field, correct?
Right, for glaucoma.
What type of tests do they look for central vision, like for macular degeneration? What are they?
So we can use a visual field, but a lot of times for the central vision, we'll use something called an Amsler grid.
Okay.
This is a very, very expensive, complicated piece of equipment, as you can see. It's about 100 years old,
Yeah.
and it's one of the best pieces of testing equipment we have for macular degeneration. And basically, it's a piece of graph paper, and you look at the middle, and you have one eye covered. You look at the middle. You want to make sure you can see the 4 corners of the grid while looking at the middle. You don't move your eye, and that all the lines are straight up and down, back and forth. Then you cover the other eye. You look at the middle. If you can see everything, you're fine. If anything starts to look wavy or kind of like it bulging, or you're missing something, that's telling us the center of the visual field is being affected with macular degeneration, or with diabetes, especially. Saying, so we hand these things out and tell people, put them on your refrigerator door, and once a day, once a week go by, take a look at it for, you know, a few seconds, look at it, and it's excellent for that.
Now, do you find that people with diabetes, I know they get diabetic retinopathy, but do they also have a tendency to have macular degeneration also, or is it not related?
Great question. And not related, but if you have diabetes, the mac degen can be harder to control because of it's all with blood flow. And saying so and we'll see it all the time. And we have, and now with, I mean, the treatment, you know, and say if you have swelling back there, the treatment is injections in the eye of some medications. I think there's 5 medications now they're putting in, but some of these people have to go monthly to get this done. And it keeps it, the good news, it keeps their vision. You know, if we didn't have it, they'd lose their vision. They'd be legally blind, wouldn't see much. And with this, they can still keep their vision. I just had a gentleman today, and he was, you know, I saw him in November, and he came in, he saw my vision's off a little bit. And I looked, I said, "You're diabetic." And he says, I was wondering about that. And I said, "Yeah, no, you've been diabetic for a while," and referred him. And he's still getting treatment now, but his vision has improved 3 lines of vision. It's slowly improving, you know, well, hopefully we'll be able to get him a little better, but you've got to have it. The great news is they're now coming out, they're researching, instead of getting monthly injections, they're going to be putting a medication in that can last for 6 months. Be putting in a port that they can just, instead of injecting into the eye, just go into this portal, and you can have it done. And if it's with the portal, the patient come in, have a tech do it instead of the doctor doing it all the time. And just to be able to, so they can go quicker with that.
So where did they, okay, since I've been diagnosed, I've been reading a lot about macular degeneration. I have the dry kind. So it's like, that's what they said. But do they like inject it like through here or into
Through the white part, it's a few centimeters, a little off the white part of off the color part of your eye, off your iris, right into the white part. And people go, "Oh no, I can't do that."
I know.
Yeah, you can, because actually they put a numbing drop in your eye and there's no pain. The only pain receptors on your eye are on the outside. Inside, it's a little uncomfortable at first, but afterwards people just go in and look up and look aside. They put the drop in. He does the injection and he says,
I don't think it would
I
hurt.
saw the doctor for like a minute. And you think about that, and that's what people do. And so when I see something that I think they're pretty sure they're going to get an injection, I do a lot of talking with the patient before they even leave my room and saying, I know it sounds bad, but this way it is. And I have a friend, he's had 110 injections
Wow.
the last 6
Oh,
years.
no.
But he has to, or else, because every time he goes in, his vision starts going down. They give him the injection, it goes back up and then goes down. So he'd be one of those that, and the problem is when they give you the injection, you get this much med. Well, over a month, it's down to this much now. So then they go back up again. Well, they want to put something in where it keeps the level of medication stable for 6 months.
It's
And
amazing. It's amazing to me that they can keep a person's vision just, I mean, in the past, if you got it, it was it, you couldn't see. So it's really a blessing in disguise. But it's like soon as I found out I had it, it's like right away it was like, oh no, plus the glaucoma, it's like, it kind of makes you worried about the future of vision as far as I'm concerned. But
and that's the difference between the wet and the dry. And that's the wet mac you generally have to have the injections, because it's wet because there's fluid separating the retina. And the retina is 10 layers of little layers of things, and everything's kind of plugged in. And when you get the wet, it starts to separate this plug. And what they want to do is they don't want to get it out here, because when they said, okay, we can get it back, well, it may go back like this, and it's not going to be really good. They want to get it before it gets out there so that it stays in and they can bring it back down to where it's plugged in the right way. And so we have to keep it that way. Dry, it works from the bottom underneath the retina and coming up, and it's taking the cells that are supposed to be lined up like this and starts to move them in different directions. And that's when people will start to see, well, distortion, that line's distorted. But the vitamins for dry macular degeneration work fantastic. Story, I had 3 sisters that came in, and their mother had wet. She's being treated. 2 of them, and they were now in their mid to late 40s. 2 of them had early dry, and 1 didn't have anything. So I told them to start taking these vitamins and minerals. Now, the interesting on this one is this is before any of the ARID studies came out. So ARIDS is with Big Pharma and medicine. And Big Pharma and medicine love to listen to themselves. And if somebody else does it, they kind of poo-poo it a little bit. And so, but we had studies from 10 years prior to that this works pretty well. Finally, they started to do their ARID study, but I told them to go on this. Now, what's interesting is these patients wanted to see their mother's retinal specialist at Kellogg. And so they did. I said, yeah, there's no problem with that. Go see them. And they went in there and he evaluated and said, yeah, you do this. And, so we'll follow you. And they said, well, we're taking these vitamins and minerals. And he goes, you don't have to do that. There's no studies that show that. And so when they talked to me, I said, well, this is what it is. I said, you can try it and whatever. So they stayed on it. Well, finally, the first ARID study came out 7 years later. And when they went back and saw him, he said, he looked at him and says, well, he goes, you ladies have been doing great. There has been no change in 7 years, but you may want to start taking these vitamins and minerals. And they told him, we have been taking them for 7 years now. And he said, well, that's good. Keep doing it. And just walked out of the room. And it's like, excuse me, I will tell you now, they're in their 70s.
Wow.
Okay. The oldest one, she's 74. She just turned into wet. And they're treating her vision instead of 20/20 is now 20/25. 1 line short, but she's been on these vitamins and minerals for 30 years. The second one, that had it, she's still doing fine, not wet. She's still taking it. She's still doing good. The third one, I never put on I never put on the vitamins. Told her she didn't have to take them. Today, she's still fine, doesn't have anything. And she says, well, why is that? I mean, why don't I take them? I said, because you don't have any signs of macular degen. Your sisters have your mother's eyes. You have your father's eyes.
Ah.
So there was no reason to take it. So people will say, well, should I take it to prevent it? If I see one little spot, I'll put you on it. If you don't have one, I don't see any reason to take it. And they
I
said,
wish I could take it, like, right now I take it every morning, but I wish I could take it like twice a day like I'm supposed to. But it kind of upset my stomach a little bit, you know.
and it does. So you'll take it with a meal. And say,
Maybe I'll
that's-
try it on, you know, try to take it twice, but
Yeah, and take it with a meal. And one of the things too is that's like with omega-3 fatty acids, fish oil, sometimes a little tougher on the stomach, and you get that. So I always take mine right after I have dinner.
it's like I have issues with reflux, and I've had issues with my stomach all my life. So it's kind of like they think maybe it's, but then you mentioned that other vitamin earlier today, something about the
MacuHealth for
vitreous help.
Yeah.
for the floaters.
Yeah.
Yeah,
So if you take one ARIDS 2 in the morning and then the vitreous help at night, is the vitreous help going to help the other issue, or is it, you know?
vitreous ones won't hurt because it does have vitamin C and zinc in it that the ARIDS has. But the kicker with the ARIDS is the lutein zeaxanthin, because it's
Okay.
everyone says eat carrots, and you have great sight. And saying the reason they do that is 95% of the back of your eye relies on vitamin A. That's all the peripheral part. The macula is only 5% of the back of the eye. So when you're looking, whatever you're looking at, you're using your center of your eye, the center, that's the macula. But that's only 5% of the back of the eye, and it does not rely on vitamin A at all. Matter of fact, ARIDS does not have vitamin A in it. It's vitamin C, vitamin E, zinc, lutein zeaxanthin, and then they throw the copper in to correct for the zinc. But that's all it is. But it's the center, those center cone cells rely on lutein zeaxanthin for their reactions, which is high in dark green leafy vegetables. So if you want to eat a vegetable for your eye, spinach is the best vegetable for your eye because it has a lot of lutein, and it does have some vitamin A. So we don't want to completely cut out the vitamin A, but it does have some vitamin A. So dark green leafy vegetables, kale, collard greens, even broccoli, celery. People say celery was useless. Celery has a little bit. Another thing, tomatoes and eggs are actually pretty good for the lutein. Have some lutein in it.
Okay.
And
That's good to know.
And
I read something about vitamin C and blood pressure medicine. You don't want to have orange juice with your blood pressure medicine.
Right,
It nullifies blood pressure medicine. And they never said anything like that years ago.
Is that true? Really? I never heard that.
Yeah.
so yeah, they
and-
told
Go
yeah,
ahead.
you don't want to take too much vitamin C. So then it's like, well, I got to take my ARIDS vitamins and I have to take my MacuHealth, my vitreous, but I have blood pressure and going. Now I look at that and I go, well, we have to see and saying start taking it. If your blood pressure is good, and then you start taking these pills and the blood pressure starts to get a little haywire, then you can talk to your physician and saying, guess what, I'm taking these for this part of it. They may have to change your blood pressure medication or add one to it.
And doctor, my husband and another lady at our church, they go to a special doctor, this Tariq Hassan out in Ypsilanti, because he doesn't put a clamp to hold your eyelid back. Some doctors want to put a clamp to hold your eyelid back to give these shots into your eye, and that it's more uncomfortable for these people to get out of the after the surgery. I mean, it's they deaden the eye, of course, but the eyelids and with dry eye, they're miserable after having the clamps put on. Sometimes doctors are they're better at giving the shots than others. So that's what they've been noticed.
Yeah, it's now, and you look at videos from like 5-6 years ago, doctors doing it and all. I mean, it's like this super sterile environment with gloves and drapes and everything. Now they say it's, just white cleaning around there. They put a numbing drop in your eye. Some doctors not even putting the gloves on. I'm thinking, oh, these gloves, but just just pull the lead, look to the side, give the injection and come out. I mean, it's a small needle. It's not very much that they're putting in, and they're doing it like this, and they're so experienced at it now.
My husband had it.
Scary to
gone-
me.
Yeah, I'm sorry, my husband's gone golfing, but he's like, after he's gotten a shot, and sometimes a little red dot follows him like a laser light, a little blood spot in the eye, but other than that, it doesn't hinder him, and he's doing good. So
Yeah,
Oh.
that's wonderful. That's yeah, with the MACD-gen and the diabetes, and even there's some vitreous or vein occlusions that we see blood in the eye. They're putting, hey, give them thing. Now, recently I've had, kind of getting different subject, 3 patients within the last about 6 weeks coming in with visual problems post-COVID.
Oh,
ooh,
I'm wondering.
They've had, and one, she's had some problems with her retina, and she sees a retinal specialist. And she came in, she says, this happened 3 days after COVID. My vision went blurry, and we did it. We scanned, we looked and said, everything looks wonderful, but yes, your vision isn't as good as it used to be. Sent it to the retinal specialist, and he looked at it and he says, he agrees. He goes, everything is, we look at the scans from before and scans after, there's nothing different, but her vision's down a little bit. And she wanted another opinion. We sent her to another retinal specialist, and he called me, says because I sent him all the data, and he says, yeah, he goes, this happens. We don't know. We can't tell. We don't know how long it's going to take to heal. But some people, it's just it could be the vitreous. It could change its consistency, its density, even though we're not seeing anything. It can affect focusing ability. So saying it's interesting because I only had 2 people in the last few years, and I've had 3 people in the last 6 weeks. So I'm not sure if the new strain of COVID affecting it or something like that. But
It's interesting because I didn't get diagnosed with the macular degeneration until after I had COVID. I had it like last February, and probably within 2 months after I had it, I went for my annual exam, and they said, you have macular degeneration. I said, I was wondering if maybe, there is other things that was on long COVID, if there's eye problems with.
And people say, what can we do about it? And we just put our hands in the air and say, it's a virus. And saying it's like we treat all viruses, it's grandma's chicken noodle soup and a wool sock around your throat or something like that, and saying we're not as smart as everybody thinks we are, especially with the COVID thing and how many different things go on, and saying but with viruses now, the good news is some of the viruses like herpes virus we can treat and stuff like that, but with the COVID there's still I've read a few different studies where over in France and Israel they're coming up with some new treatments